Over the last 20 years, a number of outbreaks of diseases have rocked the country and filled news headlines. Throughout the nation, cases of disease previously thought as all but dead have infected hundreds of people, many of whom were not given immunity through vaccination. Such a disturbing trend has sparked a debate between those who believe that vaccines should be made mandatory in order to prevent epidemics, and those who err on the side of personal freedom to refuse vaccination. In America, freedom is one of the founding values. It is a right acknowledged in the founding documents, but some argue that the country must place restrictions on individual liberty for the common good. Despite the modern uproar about this controversy, this issue has existed since the early 20th century. This controversy dates back to the Supreme Court case of Jacobson v. Massachusetts. In 1902, Massachusetts passed a law mandating that all citizens who had not been vaccinated at some point during the past 5 years must receive a vaccination or pay a fine. The case was ultimately decided against the plaintiff, who opposed the vaccine on the grounds of personal freedom. Following this catalyst, a plethora of court cases and legislation appeared throughout the nation as society felt that state governments were restricting too much individual freedom. As the cases continued, the argument shifted from mandating universal vaccination of the public to requiring children entering education to be vaccinated. These cases came to a climax most recently in 2014, when a large outbreak of measles started in California at Disneyland theme park. Even worse, the outbreak also spread to at least half a dozen other states. Emergence of this epidemic prompted California to enact SB 277, a bill requiring vaccinations for all persons under the age of 18 entering the education system. This law went further than all previous laws by removing religious and personal belief exemptions, polarizing the public over its dramatic implications. Today, the public is divided over the issue of mandatory vaccination. According to a recent CNN poll, 8 out of 10 parents believe in mandatory vaccination.
Alex Brown and Todd Benjamin say they drove right past the protesters to get their 7-week-old daughter, Adrienne, her first shots.
It definitely didn't stop me from coming. If anything, it kind of motivated me to come.
Because Brown and Benjamin believe vaccinating Adrienne is the best way to protect her.
And we want to do everything we can to make sure that she stays healthy and doesn't get any of the things that we can have vaccines for.
However, some parents have a different perspective, accusing the government of corruption, overreach, and inadequate oversight of vaccination policy.
We are making our children sick because they are putting too many toxins, too many vaccines into our kids. We need to take a look at this program. We need to take vaccine safety testing away from the CDC and create a totally new health agency that investigates vaccines and makes sure they're safe, because this establishment, the CDC, has failed the American people.
Though many parents fear mandatory vaccination, many doctors and scientists, such as Dr. Richard Carmona, the 17th U.S. Surgeon General, argue that the health risks of vaccines are negligible and that they are a deterrent for many terrible diseases.
The science is overwhelming. It's been tested over half a century. If you go back pre-1957, almost every child got measles, and it was a challenge. There were a lot of complications, pneumonias, moms who were pregnant getting infected, lots of problems. Today, we've virtually wiped out measles because of immunization, and they've been proven to be very safe and no major complications. Sometimes there are slight complications, but the overwhelming evidence says this is a good practice and it saves our country a lot of money and reduces morbidity and mortality.
Another doctor sharing this opinion is Dr. Kevin Rodbell of Sage Hill Pediatrics.
If we didn't give these vaccines, we'd have kids that would literally die. We'd have children whose lives would be changed, their parents' lives would be changed permanently in catastrophic ways.
This is not a unanimous agreement in the scientific community. Some scientists, including Dr. Russell Blaylock, argue that vaccinations can have negative effects on patients and that safety is not a settled issue.
Do you believe that all these vaccines should be mandatory?
Absolutely not. That takes away one of the fundamental rights of people, individuals and families and certainly parents, that is the protection of their children, and there's compelling scientific evidence that vaccines are not as safe as they're being proposed, that in fact there's significant serious problems, including deaths, seizures, encephalitis, severe brain damage. There's a number of problems associated with the vaccines. This is well documented in the medical literature.
Though some doctors argue that vaccines can have negative effects on patients, Dr. Carrie Byantine claims that the effects of preventable diseases such as measles are much worse.
Where pediatrician Dr. Carrie Byington witnessed the disease firsthand. She told Health Day, "I saw myself about 1,000 cases of measles in children. I saw 6 pregnant women and their babies die. These things stay with you because knowing it was all preventable, it's heartbreaking."
A common argument made against vaccines by parents and other public figures is that they have the chance of causing autism in children who are immunized. Jenny McCarthy is one of these spokesmen.
Evan was diagnosed with autism in 2005. Without a doubt in my mind, I believe vaccinations triggered Evan's autism. We do believe, because we were the witness with our child, our firsthand witness after we came home from the doctor's office and saw this regression of a child that was perfect and then slowly fading away.
Jenny McCarthy is not alone in her belief in the correlation of autism and vaccination.
Susan Daniels, the mother of disabled 17-year-old Matthew David, she says her son's condition is the fault of a vaccine.
He was totally healthy up until the day he had his vaccinations, and within 2 hours after his vaccines, he was in ICU.
However, many studies have shown that there is no correlation between autism and vaccination.
Contrary to some opinions about vaccinations, a new study has found the measles, mumps, and rubella vaccine is indeed safe for children. The journal Pediatrics released a report Tuesday that analyzed more than 20,000 studies and 67 papers on the topic. The research determined vaccines for measles, mumps, and rubella, or MMR, do not lead to autism.
The controversy of mandatory vaccination is not only seen in the lens of health benefits. Data suggests that the decision not to vaccinate children leads to an economic effect that hurts the entirety of society. According to the Pediatric Academic Society, with routine vaccinations, the U.S. saves $13.5 billion in direct costs and $68.8 billion in societal costs. However, when individuals exercise their personal freedoms to refuse vaccination, they reroute federal funding that could be used to address the many more pressing challenges in the nation. For example, outbreaks of preventable disease in 2011 cost taxpayers around the country $5.3 million. If the trend towards non-mandatory vaccination continues, the monetary repercussions will undeniably continue to exacerbate the economic hardships in America as a whole. Though the economic burden of not requiring vaccination is a significant factor, the heart of the argument over mandatory vaccination is preserving the delicate balance between individual liberty and the public good. Many parents and other advocates against mandatory vaccination argue that it is their constitutional right to choose whether they or their children are vaccinated.
We are not against vaccines. We basically want the choice. If you decide that you don't want a flu shot for your child, that should be your right. If you want to get one, that should be your right as well.
However, all Supreme Court case decisions dictate that it is the government's job to enforce compulsory vaccinations for the common good of the public. Mandatory vaccination continues to be a pressing issue as it divides the country. On one hand, the entirety of medical evidence, economic studies, and court cases support the arguments of pro-vaccine advocates. On the other, there are serious ideological disagreements over the nature of government that could go to either side of the debate. Where should the line be drawn? What constitutes common good? Is individual freedom worth the cost of public well-being? These questions and more must be answered for this issue to finally be resolved. Until then, the controversy will remain.
I really wanna immunize so frickin' bad. Protect you from those germs you've never had. Don't want want you to catch the mumps, meningitis too, pertussis, hepatitis, or the flu. But everywhere I turn my eyes, the internet is spreading lies. Oh, so many parents scared by fairy tales and hate. I need to educate so that I can vaccinate.